glad to see you, but I don't see you. Yeah. Just you see me, and I think that you are there. Yeah, and I like all of you. Okay. Today we will talk about postoperative period, and we will talk just about complications. It will be necessary to know complications because first of all they always will be with your patients, and you, like future doctor, need know how you need prevent your patients and how you will treat your patients. Okay, let's get lonely life. Okay, complications. Yeah, just complications. Complications can occur at various times. In the first 2 days after surgery, possible complications like bleeding, shock, acute heart failure, asphyxia, respiratory failure, complications from anesthesia, violation of water electrolyte balance, decreased urination like oliguria, anuria, and paresis of gastrointestinal tracts. These complications can be at first 2 days, 3rd and 8th days. There we will talk about momentum. Неудобно. Okay. Yeah, the same. They will talk about cardiovascular failure, for example, heart failure, pneumonia, thrombophlebitis, thromboembolism, acute hepatic renal failure, and wound suppuration disease. Yeah, wound suppuration. It's 3rd to 8 days. And we will talk about early complications. Early complications, it's complications what happened when patient is in hospital. Yeah. Then we will talk about late complications, but early complications after operation, all time when patients are in hospital. Okay, first complication what we will talk about, it is bleeding. Yeah, bleeding is the most serious complication of the postoperative period. It can be external, from the wound, for example, and it can be internal, hemorrhage in the cavity, yes, like chest, abdominal cavity, or in tissue. Common signs of bleeding are pallor of the skin, weak, rapid pulse, and a decrease in blood pressure. When bleeding from a wound, the bandage is wet with blood, and bleeding from drains inserted into the body cavity or tissue is possible. The increase in clinical and laboratory signs with slowly progressing internal bleeding makes it possible to clarify the diagnosis. With the failure of conservative measures is shown wound revision. One second. Yeah. No. Wound revision, reoperation, relaparotomy, retoracotomy, relaparotomy, reoperation. Yeah, we need to do a revision like relaparotomy, retoracotomy. Like what kind of operation we do before. Yeah, if we do laparotomy, we need to do relaparotomy. Okay, the next one, it's violations of water and electrolyte balance. It can lead at first day after surgery. Um, it can happen if patient have some disease which can lead to violations of water and electrolyte balance. For example, it is a pylori stenosis, or maybe it's a high age of patient, yeah, or maybe some cardiac pathology or lung pathology. Or sometimes if we talk about surgery, just surgery, yeah, electrolyte balance failure happened when we have patients with intestinal obstruction. And of course, sometimes we will talk about violations of water and electrolyte balance when we talk about bleeding, yeah, and when we talk about blood loss. Clinical signs of water electrolyte balance disorders are dry skin, increased skin temperature, reduced skin turgor, dry tongue, pronounced thirst, soft eyeballs, decreased central venous pressure, and hematocrit. Uh, and of course tachycardia, yeah, high pulse rate. What's the treatment? You see transfusion, yeah, and of course when people haven't got some electrolytes or when they haven't got some water in organism, yeah, we can give him with when, yeah, sometimes we can give it with peros, yeah, peroral, but of course we can do it intravenous, and we will talk about transfusion. It's necessary to correct the decrease of water or electrolytes by transfusion of appropriate solution. Yeah, and we remember some solutions, for example, Ringer solution, physical solution, sodium acetate, sodium chloride, sodium potassium chloride, and another. Transfusion should be performed under the control of central venous pressure. At first of all, then we need control urine released, yeah, diuresis, and of course we need control a level of blood electrolytes. And sometimes we need to understand that water electrolyte disorders may also occur in the late period after surgery. For example, it can happen with patients. It can happen with patients who have intestinal fistulas. In this case, constant correction of the electrolyte balance and transfer of the patient to parenteral nutrition are very necessary. Respiratory disorders. When we talk about respiratory disorders, we will talk in early postoperative period. We will talk about lung atelectasis, pneumonia, and bronchitis. And often these complications happened with frequent with elderly patients. And how we will prevent patients after operation if we don't want these complications for them. It's first of all early activation of the patient, because when patient activity, they will working harder, and it lead to high have working of lung, yeah, and when lung working, it way they working, they haven't got time to ill, yeah, and when lung working, they are healthy. The next one, prevention, it's pain relief after surgery. Yeah, we need to understand that patients have pain, and if they have pain, they don't will work in normal level. And if we will give them some painkillers, they will working, and working lungs lead to non-ill lungs. Yeah? Therapeutic gymnastics. It's important because it's important not just for patients with surgery. Yes, for us it's necessary too, because when we talk about therapeutic gymnastics, we will absolutely all our lungs working. Yeah, in normal situation, working just 80% of lung. Yeah, and if we have a therapeutic gymnastics, it can lead to more more better than if we don't do it. Percussion and vacuum massage of the chest. It's good too, because sometimes patients after surgery can't stand up at first days, yes, and we can help them with these manipulations. Oh, the next one is without translate, scusi signores. Inhalation of aerosols inhalations, aerosol steam inhalations. We know that if we have dry one second. We know if we have a dry air near us, yeah, and if we breathe in with this dry air, it's not very good for our lungs, yeah. And if we have some fluid in air, yeah, it will be better for our lungs. Yes, and inhalations it better than a dry air. Inflating rubber chambers. This is important too. All these measures contribute to the opening of dormant alveoli, improves the drainage function of the bronchus. All of this can lead to normalization of function of bronchus and drainage from alveoli for bronchus, all things what can lead to inflammation. The next one, it is a complication from the cardiovascular system. It happened when we have a blood loss, yeah, and patients have cannot compensation this situation. There we will talk about water balance, adequate correction, non-adequate correction of this balance, and always there we will talk, not always, often, there we will talk about elderly patients with concomitant pathology of the cardiovascular system. It may experience episodes of acute cardiovascular failure, yes, for example, tachycardia, rhythm distribution, and sometimes it can lead to increase of central venous pressure, and it is a symptom of left ventricular failure and pulmonary edema. Against the background of the main surgical disease, anesthesia and surgery in the postoperative period. How we will treat patients with cardiac failure pathology? There we can use any drugs, for example, cardiac glycoside, antiarrhythmics, coronadilators, ganglioblockers, diuretics, oxygen inhalation. Yes, all of these can help your patient, and what you need to understand, if you are a surgeon, you need please a cardiologist help you. Yes, and sometimes your work between can lead to the normalization of function of heart. Intestinal paresis. When we talk about intestinal paresis, we need to understand that after all operation we will have intestinal paresis, but sometimes it was 1 day, yeah, and sometimes it was 3, 4, 5, 7 days, yeah, and it's hard to understand why it's happened, but we need to help patients with intestinal paresis. Signs of intestinal paresis is bloating, lack of peristaltic intestinal noises, and for the prevention of this situation, we will use intubation of the stomach and intestines, early activation of the patient, normal analgesia, peridural anesthesia, paranephral blockades, intestinal stimulations. When we talk about intestinal stimulation, we talk about some kind of drugs. For example, to stimulate intestine, we can use solution of proserine, or we can talk about solution of magnesium sulfate, or we can talk about a hypertonic solution of natrium chloridium. Violation of urination. In the poster period, we will talk about violation of urination. Yeah, just when we talk about change of excretory function, yes, for example, of the kidneys, or the addition of inflammatory diseases, for example, cystitis, urethritis, cystitis, urethritis, pyelonephritis, and both situation. And sometimes we can talk about reflex character of this situation. Yeah, when we talk about spasms of sphincters in urina tractus. What about treatment? We will have a urinary catheter inserted in the bladder. It can help us to monitoring diuresis, yes, And when we talk about this pathology, we need to understand that adequate anesthesia, adequate painkillers can help us to prevent patients after this pathology. Of course, we can use antispastic agents, warm water bottle on the stomach near the urine bladder, but better is using of diuretics, yes, and more better is adequate anesthetic. And sometimes we can talk about suprapubic fistula of the bladder, but it happens just when patients have a problem with prostate, and we have a hyperplasia of prostate. Yes, when it blocked a tract of urina, and it lead to decrease of diuresis. Thromboembolic complications is the most often complications, and they are really seriously often happen with early patients. The reason of embolism and the source of the embolisms is the length of the lower extremity, lower limbs, and length of pelvis. The reason why it happens is a triad of Virchow, of Dr. Virchow. Yes, it's a slowing blood flow. It's the change of the and damage of the wall of the vessel, damage of wall of the vessel. It all can lead to thromboembolic complications. How we will have people? First of all, it is early activization of patients. Then it using of treatment of thrombophlebitis. The next one is bandaging of the lower limbs, and correction of the blood coagulation system with drugs, anticoagulate drugs, or and anti-aggregate drugs. And the last one, how we can help people, it liquid transfusion, fluid transfusion, right? Transfusions, yeah. It lead to hemodilution, what can prevent patients with thromboembolic complications. The next one, it is a development of wound infection. It happened often in third or 10th day after operation. Signs of the wound infection. It is a pain in the wound, increased body temperatures, tissue compaction, inflammatory infiltration, hyperemia of the skin around the wound. How we will treat patients? If we see some indication of the wound infection, we need to do a removal of debridement of wound, yes, and if we need, we will do a removal of sutures all sutures or some sutures. And then we will working with this wound like with purulent or with suppurative wound. And the next one, it is a late complications. It's complications what happened with patient when he go home. Yeah, there we will talk about some syndromes. For example, if we talk about cholecystectomy, after operation, patients have a post-cholecystectomy syndrome. Yeah, if we talk about operation in the stomach, we talk about operated stomach diseases. Sometimes patients will feel phantom pain when we talk about amputation of limb. The next one, post-thrombophlebitis syndrome. Yes, the next one, adhesive disease. It's important to remember because all patients will have adhesive disease. The next, it's ligature of ligature fistula, postoperative hernias, and keloid scar. That's all what I want to say you today. Now we will check your knowledge with a small test. Don't forget answering comments. Okay, don't forget comments down below the video. Yeah. First question: what complication you see on this picture? What is this you see? Yeah, and I want to show you this leg. Yeah. The next one: what complication you see there? What is this? How you thinking? The next one: what complication can happen if we see this after rectal checking? What complication, number 4, yeah? What complication you see on X-ray? And the last question, number 5, it's a video. Okay. What complication after operation, it's late complication you see there? It's first question, first 5A and 5B. Look, what symptom I pleased patient demonstrate? Okay, that's all what I want about you today. Thank you very much for your attention. Have a nice day, have a nice week. Don't forget that surgery is necessary if you love it. Okay, I love surgery. I will try give it to you. Thank you very much. Bye bye. Comments.